Welcome back to Living 808. The Ferguson Clinic is considered the one-stop shop for all your aesthetic needs.
That's right, both surgical and non-surgical, and now they have a new form of treatment that everyone is loving, including Trini.
We are here at the Ferguson Clinic on Ala Moana Boulevard. We're chatting with Dr. John Ferguson today. And doctor, you guys really are known as kind of a one-stop shop for women. What are some of the services that you offer?
Well, not only for women, but for men too. We've really been trying to expand everything. Because you know, at heart, I'm a surgeon. And that's what I love to do. But there's so much more out there that we can offer our patients that we've just tried to expand. But once again, I mean, at heart, I'm a surgeon. So I love doing surgery. This is our operating room where I get to do all the fun stuff that I like to do. Like facelifts, and noses, and breast implants, tummy tucks, our laser lipolysis we do in here, just about any kind of surgical procedure you could think of aesthetically. And that's where we started out. But now it has become more of a one-stop shop where we have more and more people coming in just for some of these ancillary procedures that I don't even want to call them ancillary anymore, because that's a lot of what we do now.
I want to talk more about that in a moment, but first, when women come in here for a facelift, tummy tuck, whatever it may be, I mean, this is kind of life-changing for them, right? So what are some of the reactions that you get when people walk out of here? Of course, not immediately after, because they probably need some recovery time, but you know what I mean?
Well, you'd be surprised. A lot of what we're trying to spend what we try to spend a lot of time on now, as far as research, things like that, is how we can get people back as quickly as possible to their normal lives. Like for me, my goal for a tummy tuck is to be at the beach in 2 weeks in a bikini. Well, not me personally, but the patient to be. Getting the patients back to their lives as quickly as possible, as happy as possible.
Okay, I know that you guys also do non-surgical procedures. Now, do you do them in this room as well?
This is primarily where we do most of our surgeries. We do have a couple of different rooms where we separate between minimally invasive and non-invasive stuff. So why don't we go check out some of our other areas?
Okay, sounds good. One.
Well, Trini, this is where we do most of our minimally invasive type procedures, ones that don't really require any kind of anesthesia, and where I get a lot more assistance from our estheticians and our aesthetic nurses that we have. This is like fillers, like with Botox, and Botox, or fillers like Juvederm or Restylane, those kinds of things, but also a lot of skin type work that we do in here. We do our laser facials in here. We do a lot of microneedling. We do our hair restoration in here. We also do something called Profound. And Profound to me is one of the most exciting things out there. This is one of the first, actually in my experience, the only device that can really rejuvenate all three aspects of the aging skin, both collagen production, elastin production, and hyaluronic acid production. And to be perfectly honest, it's knocked out about 10 to 15% of my facelifts because it's so effective in treating the facial skin as well as all parts of the body.
Okay, doctor, I'm getting my notepad out. What was it called again?
Profound.
Profound.
Yeah, it's amazing. For our minimally invasive procedures, it's one of the best that I have ever seen. And like I said, it can actually take the place in some circumstances for a full facelift.
Wow. I got to tell you, as I get older, I am so appreciative of all of these non-invasive options, right? Because, you know, it's scary sometimes to go under the knife. So, you know, it's nice that there are some other options out there.
And we actually do have quite a few non-invasive options too, where there's absolutely zero downtime. There's no ablation of tissue. You can get back to your normal activities 5 seconds later.
Actually, I'm glad you mentioned that, because you guys are known for your HydraFacial, and I happen to be in need of a HydraFacial. I've never had one before, so do you think I could get that done today?
You absolutely can. That is one of my favorite, you know, out of everything that we do, that I have here, this is the only thing that I do.
Okay, well, let's go.
I love doing it.
Let's go.
All right, come on up. Well, Trini, how you doing there?
I am doing great. Shabby is taking good care of me.
Great.
Shabby, can you explain to our audience the benefits of a HydraFacial?
Sure, Trini. The HydraFacial cleanses, it exfoliates, it does extractions. It's a great way to brighten the skin. We can add boosters. There's a skin brightening program that can be added. You can really cater each person's treatment for their specific needs. And it takes about 30 minutes, so it's a great lunchtime special.
30 minutes. That's it.
Yep.
That's fast.
Yeah, you can go right back to work.
This is a perfect gift idea for, you know, holidays right around the corner.
Yes, it is.
But it's also a great gift for yourself.
Yes, it is.
All right, well, Shabby, thank you so much. Again, this is just one of many services that you can get here at the Ferguson Clinic.
You notice she's talking while getting this treatment, so no pain involved, just a lot of sucking, and the stuff that, in fact, everybody in the office, I was on the shoot, by the way.
Yeah.
There it is. Oh, that's what they suck
no
out of your face.
way.
It's like, and
That's
everybody in the
amazing.
office loves to see the gook that
I
comes out
love
of
it.
with the little stuff in the bottom, and they're shaking it around. I'm like, it's so gross,
But it's so cool because it's
wonderfully
like cleansing your face.
yeah,
You know?
it's so wonderfully. Yes,
I
it makes your
feel-
face all nice.
Yeah, I feel super inspired. I was actually just having a conversation with my girlfriend last night, and I was like, I've never really had a skin routine. I've been super lazy my entire life, like just washcloth and that's it.
Yeah.
And I was like, I'm gonna make it a point this year to start getting facials. And so I think it was meant to be that I saw this today.
As everyone who watches this show knows, I moisturize.
So you have a better skin regimen than me, is what you're saying.
Oh, no, yeah. So I do the elbows. I do all the places that you're supposed to do, you know, under the eyes, and then the place where you get the crow's feet.
Oh, my gosh,
But I
John.
have this problem. Let me just see if everybody can see it.
Oh my.
I have this problem right here. See that right there? We're gonna get that all fixed.
I think that they can fix that for you.
All right. Much more to come on Living 808. In fact, got a tech head on your Christmas list after the break.